So I just watched the video of the doc talking about how degeneration doesn't exist. It's not real. We should never be telling patients about that. And here's the thing, is he has no idea what he's talking about. Degeneration is a real thing. It is not something that's normal. He is confusing normal with common. Common means it happens a lot of the time, and normal means it's supposed to happen, and if it doesn't happen, that's abnormal. Basically, what he is saying is that degeneration is how you're supposed to age, and if you don't have it, that's considered abnormal, and that's when you would need intervention. It makes absolutely no sense. Why would someone who has great spacing, no osteophytes, no osteoarthritis going on, why would they need to seek medical attention? They're not going to have any symptoms from that because that's normal. Not common, that's normal. Now, on the other hand, we have people who have degeneration, and while it is more likely to happen as you age, it doesn't mean it only happens when you age. Again, that's because it's not a normal part of aging. I've seen people 12 years old who have huge osteoarthritis after they've had an accident or injury that went untreated properly for 2 to 3 years. Because if we actually look at research and literature, which he is not doing here, when we look at actual research and literature, it tells us that post-accident injury, osteoarthritis, and degeneration can set in as little as 6 months. Not 50 years, 60 years, 6 months. And the reason that happens is because of multiple things, but the main two is called Wolff's Law and the gating mechanism. What that means is that your body is going to move differently to take pressure off of the injured tissue to allow you to not be in as much pain. It's trying to give you time to heal, but when you don't heal properly, it creates abnormal force and pressure over that hard tissue like your bone. And when you have abnormal pressure over hard tissue for long periods of time, it remodels that bone and creates more of it. That's what Wolff's Law is. Again, if this was normal part of aging, would have never researched that. Because again, this is not normal. This is what happens when we have abnormal pressure over joints for long periods of time and can happen in as little as 6 months. This is why it's so important to get checked out. Now, however, saying that you have the spine of an X-year-old or the spine of this person, we don't do that. We don't put up any kind of degeneration charts or things like that. I don't like any of that, so I kind of agree with him. We don't really use any kind of scare tactics like that. However, just saying that, oh yeah, this person who has a 3-4 millimeter osteophyte at the L4 that's grown up and almost fused to the L3, that's normal and there's nothing we should do about that, is just completely ludicrous. I would be willing to bet that he does not have any postdoctoral training, any kind of biomechanical hospital training, trauma training, anything like that. I can tell you as someone who does have that, it is not a normal part of healing. Please do not believe that, because the longer you wait to get any kind of treatment for these kinds of issues, the less likely we're going to be able to get positive improvement, and the more likely that you're going to be doing things like surgical consults with potentially shaving off bone spurs or having fusion or replacing the disc. So yes, always get things checked out earlier. That is not normal. He is mistaking common and normal. Please don't do that.